I have two challenging PDI stories that I can share with the group. So the first one is a 6.5-year-old Hispanic male who really wanted to live with his biological mother, but there was a whole trauma history there. And so he was currently living with his grandparents. Super sweet family. They had a pretty good dynamic, except for the fact that he really wanted to live with biomom and was struggling with that, sort of blamed the grandparents for needing to live with them. So he was demonstrating behavioral problems like many traumatized children do. And so he had the trauma symptoms, kind of classic trauma symptoms on top of the behavioral problems that he was presenting with. And so they came in for PCIT, and just a side note, PCIT is one of the best practice standards for treating traumatized children, so it was a really nice fit. Worked with the grandparents for a long time. It took them a long time to get through the CDI skills and meet mastery, and even then it was sort of touch and go sometimes. They lost the CDI skills pretty quickly once we started PDI. But the very first PDI session that we did, it was this marathon session. It was this kid who he kept getting out of the timeout chair. He would wander around the room. He would turn the lights on and off. At one point, he got super aggressive with his grandmother. And his grandmother is this Hispanic, she described herself as old school kind of parent, and she was furious that this kid had hit her. And so she actually, she left. She walked out of the playroom and left Grandpa there to sort of monitor the situation, but she went out into the waiting room to take some deep breaths, and it ended up that I actually had to go out and get her from the waiting room and sort of talk her into finishing the timeout sequence. So that took some time. But this was a kid who, it was on the chair, off the chair, backup room, on the chair, like back and forth. And the whole thing lasted 3.5 hours long. It was to the point where like we'd started it at 3 or 4 in the afternoon, and this kid was falling asleep on the timeout chair by the end of it, which is sort of our in for him finally being able to comply with it. So that was the first session. PDI 1 was 3.5 hours long. It was crazy. The grandparents were really frustrated with it. They were really skeptical about it. Came back for a second week, and we had to do timeout for about 75 to 90 minutes or so. And so same kind of thing, on and off the chair, but half the time. So that's great. And we're seeing progress there. And then what I love to share with our trainees is that after that second time, we never had to do timeout ever again for the rest of the treatment model. And so I really share that as a success story, even though the first PDI session was really crazy, and it was sort of a big ask from the caregivers to be able to devote that much time and effort into this process. It completely paid off in the end. So this 3.5 marathon session, and then we never had to do it again. And so I actually use that case to describe what this can be, to sort of prepare parents and say, look, it could be really crazy for these first couple of times. The behavior tends to get worse before it gets better during this time, and then it really gets better, and you're setting these kids up for these lifelong healthy trajectories in terms of their young child behavioral practices. So that's a cool story. The second story I want to share with the group is from a newly minted 4-year-old who also has a trauma history. She has a child sexual abuse history, and she is one of those kids that she's very defiant, and she takes pride in her defiance, and she tells everybody exactly what she's going to do and sort of announces it. I'm going to do this, I'm going to do that, whatever the poor behavior is. And this is a kid who likes to take off her clothes, and so she will just announce in the middle of the session, I'm going to take off my shirt, I'm going to take off my pants, and then she does, which is super awkward as a clinician, especially a trauma-trained clinician. We're not supposed to see kids' private parts. That's not part of what we should be doing as mental health professionals. So it can be really awkward. But the parents have done a great job with ignoring that behavior. So that was something that we've really worked on. This is a kid who also was doing in-home PCIT as part of the COVID adaptations that we were making. And this was a kid who would announce, like, I'm really upset with you. I'm going to go purposely pee on the floor. And so she would stand on her bed and purposely pee on the bed to try to get attention from the caregiver. And it works, right? So this kid learned very quickly that when she engages in this kind of shocking behavior, she gets a big response from the caregiver, who rushes over, gives her a ton of one-on-one attention, and tries to get the kid to stop peeing on the bed and on the floor and on the carpets and all that. And so over time, we've been able to coach that parent to say, you've got to ignore that behavior. If you give it attention, it's going to be a problem. So what we ended up doing is that this kid is using the backup room. They've created a backup room in their home. And so the kid will go in there and she will purposely pee on the floor and she will splash around in it. It's like she's splashing through a mud puddle, playing in the rain kind of thing. And she's expecting to get a lot of attention from that behavior, but the caregiver has made really good strides in not giving that behavior attention. And so it is starting to go away. And the follow-up command to that particular situation is that she's got to clean up her mess, right? So the second command is that she's got to go get the paper towels or the towel or whatever and clean it up. So we're starting to make some progress there, which is nice. It's the case that I'm currently working on, but it's one of those cases where she has a lot of significant behavioral problems, and part of it is stemming from the trauma history, and so we're balancing those needs on top of this kind of shocking behavior that she gives. So those are some of my favorite PDI stories.